But I'd like to welcome you to our webinar for this evening. My name is Amy Boyle, and I'm the president of the board for BirchBark Foundation. I've been involved with BirchBark for many years, and it's great to have you all here tonight. I I know this webinar is important. It was of special interest to me too. I'm looking at having a dental procedure done for my dog, so I signed up independent of hosting the webinar. But welcome to you all. We do these webinars quarterly as part of our education series. So BirchBark Foundation, in addition to providing pet aid, which I'll talk about in a little bit, we also do some education series like this once a quarter, and we also do some grief support for people who are anticipating or have recently lost a pet. Um, the mission of BirchBark Foundation is to protect the human and protect and honor the human and animal bond. And that is really about providing assistance to vulnerable families when they're faced with unaffordable medical expenses to save the life of a pet. And I think we can all imagine what that would be like. Um, the we have these three pillars of our organization that are that pet aid, the sort of the medical assistance, veterinary assistance, the education programs like what you're experiencing today, and then also the grief support that we do. We are 100% donation based, 100% donation funded. And so if you like what you hear today, and if you'd like to support the work that we do and helping the pets that we help, you can make a donation at birchbarkfoundation.com, which is our website, and there will be a link in the chat as well that you can do that there. But this webinar is completely free of charge. There's no obligation, nothing like that. We just wanted to welcome everyone and talk a little bit about dental health in our pets, which is a very important topic. So at first, I'd like to introduce Marianne Birch. Before we get to Dr. Jeff, who's our speaker tonight, I'd like to introduce Marianne to say a few words about BirchBark Foundation. Welcome, Marianne. You're muted, Marianne.
My dog was being raucous. I had to mute before, so I apologize. Thank you, Amy, and welcome everyone. Many of you may know me and know about what BirchBark does, but one of the reasons that the webinars are so important to me as part of the human-animal bond, besides preserving it through our financial aid, is to honor it by making sure we're the best advocates that we can be for our pets, that we're educated enough to know what the right things are and to make decisions from the love in our heart and the knowledge in our heads to really be the best caretakers for them. And so the webinars are to make sure people know what's out there and some of the advances in medicine. And we are also happy to say that because February is dental month, most of the time, traditionally in veterinary hospitals, that BirchBark has a special dental promotion. So the people that qualify financially for our help with their pets this time of year can actually get an additional grant to help pay for dental care that might be essential for the health of their pet. And we're very proud of that as part of our recognition of what's important in keeping your pet healthy. So thank you all for attending, and I look forward to hearing what we have, the information that Dr. Jeff's going to share with us. So.
All right, I'm going to try and open my presentation here. Can everybody see it now?
Not yet.
All right, help me out here,
Yeah,
Rebecca.
does
What
the
do I need
share,
to do?
you're pushing the share screen there at the bottom?
I thought I did.
Let's try again.
Let me go back.
While Dr. Jeff is finding his presentation, I'll just add that
Mhm.
we are going to do a Q&A at the end of this. I neglected to say that in my opening comments. And so at the bottom of your screen, you will see there's a typical chat box, and then there's also a Q&A box with a question mark. And ideally, if you could put your questions in the Q&A section, that's great. But if you forget, you put them in the chat, that's fine too. We'll find them there, and we'll get to as many questions as we can at the end of the day.
Okay,
Yeah.
did I get it right this time?
We still see you, Jeff.
You don't see.
Oh,
All
here we
right.
go.
Let me try a different one. How about now? There we go. I'm seeing something different.
There we go. Yay.
Okay, I will talk faster. I apologize for my technical incompetence. My name is Jeff Fankhauser, veterinarian. I've also recently joined the board of BirchBark as well. And my topic tonight is an introduction to small animal dental care. Do I really have to brush my pet's teeth? A question I get quite often with my clients. I've done a few dental talks over the years. The last one I did was for animal welfare staff and veterinarians, so people working in shelters and how to do dentistry in shelters, because that's where most of my dental experience came from. And I've done some presentations to shelter volunteers at some shelters I've been at. So I made some changes to this. I'm trying to do just sort of an overview of a lot of issues related to pet dental health, and why we may or may not be as aware as we should be of taking care of our pet's teeth. Um, I'm a general practitioner, so I'm not a dental specialist. There are veterinary dentists. Most of my career, I've worked in animal shelters or in nonprofit or low-cost type practices, doing a little bit of everything. But especially at the last shelter I was at, we did a lot of dentistry, and I came to really believe in the value that those procedures gave to my patients. And I think today I feel I make a bigger difference in the lives of my patients through dentistry than through any of the other things that I do. So just as an overview for the talk, we'll talk a little bit about pros and cons of brushing, why either brushing or dental care is relevant in veterinary patients, and some components of that are regarding perceptions, both in the veterinary field and among pet owners about dental care for their pets. I'll go over basics of what we mean when we're talking about veterinary dentistry, what's actually happening behind the scenes, a little bit about cost, because that's always a concern. I always get questions about that. And then talk about some of the products on the market or other alternatives to your typical involved anesthetic dental procedure at your veterinarian, or alternatives to just your physical brushing of the teeth of your pets. And then I'll just talk you guys through very briefly what I tell my clients when I'm encouraging them to give brushing a try for their pets. So pros, we brush teeth in our pets for the same reason we brush our teeth, to maintain or maybe hopefully to improve the pet's overall health. When teeth are compromised, dental infections can certainly cause infections elsewhere in the body. So the way that works is when the gums are inflamed, when you have really bad gingivitis, the bacteria around that tooth or in that mouth can move through these more porous blood vessels into the bloodstream and settle out in different parts or different organs of the body, and cause infections. Classically, there's a valve, the mitral valve in the heart, where these bacterial infections will get seeded, cause inflammation, cause damage to that valve, and you'll get heart murmurs and progressive heart disease in those patients. And then also, when we have problems with our teeth, either the teeth are fractured or we have infections or loose teeth, they hurt. When I have a toothache and it hurts like crazy, I can look at it in the mirror and I don't even see gingivitis sometimes. So when I look in the mouths of my patients, I have to believe a lot of those teeth hurt. A lot of those pets are experiencing pain, but the drive to eat is stronger than the drive to avoid pain. Just because your pet is still eating doesn't mean their teeth don't hurt. Doesn't mean they're using their teeth. Often animals will just swallow the kibble whole. And then ultimately, and I think what drives a lot of my clients to be a little bit more willing to try brushing, veterinary dentistry is expensive. We'll talk a little bit about why, but it costs a lot of money. On the cons, it takes a lot of time to train, sure, to train the pet, but really mainly to train the owner to build it into their routine. Some pets are definitely harder to handle, maybe impossible to handle for brushing. And when there's already disease present, those teeth are likely uncomfortable, and the brushing may cause pain, and that's going to make it more difficult. This last bullet point, perceptions, it's just we don't generally think about our pets' teeth, and we don't generally think that we need to be doing anything to keep their teeth healthy, and we're reluctant to do anything about it even when they're not, just generally speaking, just kind of culturally where we're at. So, in terms of evolving perceptions, perceptions on veterinary dentistry have changed in the veterinary field among veterinarians, as well as they're starting to change in the general public. And prepping for this talk, I was interested to find the first veterinary dental school was established in Lyon, France in 1762, which is wild because here in America, we're way behind that. The American Board of Veterinary Dentistry didn't get accredited until 1995. I believe that was the year we had our inaugural class of veterinary dentists or veterinary dental specialists. And so for, the last couple of generations, there's been an increased awareness in the value of dentistry, increased presence of dentistry in your average veterinary practice. When I was in high school, my first job was working as an assistant at a veterinary hospital, and I brought my best friend's dog into the clinic because her mouth smelled horrible, and certainly it was rotten. And because it was my friend's dog, the veterinarians walked me through the dental procedure, let me extract some of the teeth. But even though they were doing dentistry, it wasn't a focus of the practice. We didn't have a high-speed drill to remove bone around the teeth or to section the teeth if there's multiple roots. We'll talk more about that later. And we didn't have dental x-ray. But that's kind of was the reality at the time back then. But increasingly, more and more practices are offering more and more elements of dentistry, including dental radiography or x-rays. And so it's getting more popular. And even among the large animal vets, it used to be a generation ago, if you talk to a vet about, oh yeah, we should be doing dental procedures on cats and dogs, they kind of laugh at you. But as an industry, we learned that once we started floating the teeth of horses, and that's what we call filing down the tops of the teeth of horses. Their teeth grow throughout life because they're grinding on grains and grasses that wear teeth down, but they sometimes will grow little spikes or hooks on the tips of the teeth. When you file those down, those horses are a lot healthier and can live as much as twice as long. And so it's undeniable the value that dental care plays in their lives. And so we can kind of see it in our own pets. And we also know the value of dental care in our own lives. And so it's kind of important. In terms of prevalence of disease, these numbers come from a statistical analysis that Banfield, the veterinary hospital chain Banfield, will look at their own data and every so often put out reports. And so a few years ago, they did some data on dentistry, and from their data, 68% of all of the cat patients they saw had significant dental disease, 76% of all dog patients as well. So it's the most common disease in dogs and cats seen at the veterinary hospital. Interestingly, this image is from the American Animal Hospital Association's website, and somehow that is not me, but it very similar in profile. Okay, so I'm a veterinarian. I do a lot of surgery. Stuff just doesn't gross me out, but there's really no way to talk about dental disease without some sort of less than pleasant images. There's a couple parts of my talk where I'll have this pop up just so kind of give you a warning in case you want to glance away. This one isn't the scary image. Those are coming. So just this is sort of what I would consider roughly mild disease. Not every vet's going to kind of agree, but this is maybe a little bit more toward moderate. But you're seeing some tartar here. This is calculus that is forming here, and you are starting to see some early inflammation of the gum line or gingivitis. And you can see something similar in this cat. More moderate, these are both not good examples of moderate. I think this is still leaning toward mild. This one is more severe. These are probably teeth that are going to need to be extracted, but there's something in the middle. And then I jump all the way to the most nightmarish cases. Most people, if you don't work in a veterinary hospital, never get to see this kind of stuff. But if you work in a veterinary hospital, you see this more often than you would like. I'll admit these are very advanced cases of periodontal disease. But this is not uncommon. We see the full spectrum. The majority of pets I see, I think, need dental care, need a dental procedure, likely need some teeth extracted. And I say the need in all of that is because there's very likely pain, there's very likely infection. They're certainly not all this bad, but I think it's kind of relevant to know how bad it can get. They don't have hands. They can't rub these clumps of fur and mucus and plant material out of their mouth. And if that just sits there on the gums, the disease just rapidly gets worse and worse. And then there's species-specific concerns. So some breeds have special issues. Cats have a couple of things that dogs don't generally get. And so in dogs, brachycephalic. So that's the term for dogs with the short muzzles, like your English bulldogs, French bulldogs, boxers. The teeth are kind of more crunched together and rotated because that muzzle is shorter, and because they're abnormally aligned, they're more prone to disease. In fact, I went to a dental presentation where the dentist argued that, or said that in his brachycephalic patients, he routinely extracts the little premolar right in front of the big carnassial tooth on the top. That's the big tooth for crunching. He removes the little premolar in front of it because they're always rotated, like 90 degrees. They're in the wrong, and they always get disease rapidly. And when that tooth gets diseased and the bone around it erodes, that can erode the bone around the carnassial tooth and threaten that. And that's a much more strategic or important tooth that you don't want to lose. So it was interesting for me to think to proactively extract teeth even before disease sets in. Malocclusion, so that's underbites, overbites, a variety of other issues that make the teeth not fit together. And so the rubbing of the teeth or the way they work in the mouth leads to more rapidly progressing periodontal disease. Gingival hyperplasia, classically, this is a boxer thing, but there are other breeds that'll have it. And this is just by definition, hyperplasia, overgrowth of the gingiva. That's going on in this image. But I believe there's also a type of tumor of the periodontal ligament called an epulis going on here too. So a little bit of everything. Either way about it, kind of an advanced case. But when you get these gingival hyperplasia cases, the gums are just growing too much. They're starting to kind of bury the tooth, and that creates a big pocket where the bacteria can thrive, food gets packed in there, and the teeth are more at risk of infection. And so in the procedures, we'll trim those back or cauterize them back, remove the masses. So there's some other things that lead to these mouths being less healthy, more painful. There's also oral tumors that can happen, and unless you're really looking in your pet's mouth, you're never going to know. Dental fractures, so either from trauma or fights or chewing too aggressively on things that are too hard, the enamel on the outside of the tooth can be fractured. The tip of the canine teeth up front can be fractured. And when you lose the enamel, the more porous part of the tooth is exposed, and that allows bacteria to go deeper into the tooth and potentially cause a root infection. It allows for the potential of pain because we're closer to the nerve inside the tooth, and so often fractured teeth, or certainly a complicated fracture, needs to be extracted. And then teeth that chew on things that aren't so hard, like tennis balls classically, will wear their teeth down. And as long as that wear happens slowly over time, the tooth has the opportunity to form what we call tertiary dentin, which essentially replaces the enamel and continues to protect the tooth. But if it wears down too fast, you expose that more vulnerable part of the inside of the tooth, and those are potentially painful and set up for infection as well. So with cats, they've got a couple unique disease processes that definitely are relevant. So these images are of something we call feline oral resorptive lesion. Essentially, this is the cat's immune system attacking the enamel of the tooth or attacking the tooth. So they create their own cavities. And they're not always this obvious, as you can see in these images, but where you see the arrows in the image on the left, you can see how the gums on that tooth are inflamed, more inflamed than the gingiva surrounding. And then you can kind of see how the margin of the gum is climbing up the tooth a little bit. And you'll kind of, whenever I see that, I know it's very likely something like this resorptive lesion is going on. And so that's the gums are responding to the inflammation from the breakdown of that or from that lesion and trying to cover it up there, but it always doesn't get covered up. So these teeth are compromised. There's really no way to save these. These need to be extracted. The statistics on prevalence of this are hard to really pin down, but I would say probably around 20% of all cats can form these. And so it's definitely something that it's worth being aware of. This is my least favorite condition. It's called feline lymphocytic plasmacytic stomatitis, or just stomatitis. Stomatitis definitionally is inflammation of the mouth. And so we're not just talking about the inflammation around the teeth or gingivitis, but you get this inflammation in the back of the mouth. So in this image of the poor cat with the wide open mouth, you can see the sort of stippled or cobblestone appearance of the tissue at the back of the mouth. It's pretty inflamed and red. This condition can be a wide spectrum, from a minor case where there's a little bit more inflammation, or there is a little bit of inflammation at the back of the mouth, to just absolutely horribly proliferative or thickened and inflamed tissue. You know, some of these mouths, when you try and open them, the gingiva is so inflamed it just bleeds. Definitely compromises quality of life, and it's very difficult. With this one, you have to you usually start by removing all the teeth in the back of the mouth, and some of those and cleaning the teeth in the front. Some of those cats, that's all you need to do, and they kind of go back to normal. A percentage of them still have painful inflammation even after you do that. You got to go back, take all the rest of the teeth out, and then that's enough for some, but there's still a percentage that even after you take all the teeth out, there's still painful inflammation that will form, and you have to manage it medically with periodic courses of antibiotics, or maybe periodic courses of immune modulators like cyclosporin, or even steroids to knock back that inflammatory response. Okay, and then just sort of going to run through some basic understanding of what we mean when we're talking about dentistry in the veterinary field. We used to standardly refer to dentals and pets as dental cleanings, but because that's what we think of when we go to the dentist, and it involves the scaling the teeth, polishing, taking x-rays, doing a periodontal examination. That's all we think. I almost never get to do just a dental cleaning. I almost never get to just address preventive dental health, because most of us don't think about the teeth until it's a problem. And so most of my dentals involve several extractions. So most of the time, my dentals are the cleaning, and then I roll right into oral surgery. And that's where all the time goes. And it can take hours to deal with all of the diseased teeth, all of the extractions that need to be done. And it can definitely take hours until you've done a lot of dentistry, and you've been able to develop better techniques and more experience and more efficiency so that it's not physically exhausting and emotionally exhausting. Myself and several of the vets I know that do a lot of dentistry went through a phase where a single dental procedure could go on for well more than 5 or 6 hours. And that's not only physically exhausting, but dentistry is pretty invasive, pretty traumatic to the patient. And so you feel bad for your patient, even though you know the good that you're doing by removing those teeth. So you have to do a ton of dentistry. It's not easy. You don't get good at it overnight. And so it just takes a lot of time. And so I'll talk a little bit about what is a simple extraction, what's a complex extraction, and the different components of, lifting up the gingiva and burring out some bone, sectioning teeth, and how many roots they have, and closing. And then just as a note, we do have specialists in veterinary dentistry, and almost anything you can think of that's done in human dentistry, it has a correlate in veterinary dentistry. We do orthodontics, we do endodontics, so root canals, crowns, everything else is possible. I've done some training in some of those things, but I haven't really done that in practice. The dentistry in my practice is really focused on addressing or eliminating pain, infection, or the risk thereof. So I'm not going to go in deeper to those more advanced procedures. You may hear your veterinarian talk about the stage of dental disease for your pet. Really, these stages refer to what's going on under the gum line. So when we're looking at teeth during an exam, we're kind of guessing about the stage. But stage 1, we just have inflammation of the gums. We haven't really lost a significant amount of bone around the root. Stage 2, we've lost less than 25% of the total bone around the root coverage. And we're kind of talking about top to bottom, so from the crown down to the bottom of the root. Stage 3, 25 to 50% of that bone is lost, and stage 4 is more than 50% of the bone has been lost. And so when you're right around that 50% cutoff, that's when sort of the rule sets in that you really have to remove that tooth. In order to bring a tooth back to health, in order to get this bone to regrow around the tooth, takes a lot of work. A commitment for daily brushing, probably sort of application of long-acting antibiotics and other things at time of initial dentistry, and you have to follow up with very frequent dental procedures to make sure that you're keeping that tooth healthy. And then it is possible for some of that bone to grow back. In reality, the vast majority of pet owners, the vast majority of my clients are simply not going to do that, or unable to do that. And so once you've lost that much of the bone around the tooth, that's a rule of thumb that leads to extraction. Okay. I don't know why that is repeating. Okay, sorry. Okay, so basic dental cleaning. So even though it's just the cleaning like we go to the dentist for, it requires anesthesia. You're going to have to put the animal under anesthesia in order to use a lot of this equipment. It's going to scare them a lot otherwise. And then certainly if you're going to take x-rays, you're not going to put, a $10,000 x-ray probe in the mouth of an animal that's awake. And if you're not taking x-rays, you're missing a significant part of the tooth. We'll get into that a little bit later. This image is at the shelter that I worked at in Denver. And this was after we had committed to doing dentistry. We bought a lot more additional equipment. So you can see in the image, we have these dental machines with burrs and polishers. We have, your routine anesthesia machines and pet warmers, but then we also have dental x-ray units that we would wheel around, and extra lighting, because you really have to have bright and focused light to know what you're doing. So, we really committed a lot to that dental suite, and we used it a lot. In this image, there's 3 veterinarians actively doing dentals, and there's another dental being prepped on the other side of that wall. So scale and polish. So we have this ultrasonic scaler. So it vibrates at a really high speed, and it chips away the tartar that's formed on the outside of the tooth. You have to be very careful when you're using these, leaving it in contact with the tooth, certainly any part of the tooth for a very limited amount of time. You have to move smoothly because this will also etch into the surface of the enamel. It'll damage the surface of the enamel. So if you use one of these ultrasonic scalers, you have to polish afterwards. So in this other image, we're polishing the teeth. This is the same thing that happens when we go in for a cleaning. And the polish cleans the tooth a little bit more, but also repairs the surface, enamel surface of the tooth so that it's not prone to more advanced progressive dental disease. When we have them under anesthesia, we will do a periodontal evaluation. This is the same thing that happens when you're at the dentist. This is when you hear either the dentist or the hygienist call out to each other numbers, 5, 5, 4, 3. They're talking about how many millimeters the gingival pocket is. So the pocket between the start of the gum line and the tooth, and there's a natural pocket that's maybe 1 to 3 millimeters, depending on the tooth. And there's certain rules. So if you have a deep pocket, like 5 millimeters or more, depending on whether it's a cat or a dog, then that's too much of a pocket. You got to do something about it. You may need to extract the tooth. And then the other image, we're using the sharp tip of a dental instrument to feel the surface or to probe the surface of a worn tooth or a fractured tooth. And so you're trying to see, is it nice and smooth sliding across the surface? Okay, we have tertiary dentin. That tooth has had time to heal and protect itself. Or is it rough? Or worse yet, does that probe drop right into the canal inside the tooth? And those are complicated and need additional care. Very likely that probably usually means extraction. Okay, dental radiology. This is a system. This is a system that I have. I really like it because these handheld X-rays devices are easy to get subtle variations in angle. The older versions were on a large arm that you'd have to wheel this big base around and have this X-ray device like this, but that was attached to an arm, and they were just really cumbersome. This is a lot easier to use, but radiographs are really important. The majority of the tooth lives below the gum line. So if you're just looking at the outside of the tooth, you're just scaling and polishing the outside of the tooth, you're missing stuff. Studies have shown that in dogs, roughly 20% of teeth that look normal from the outside show significant disease on X-ray. In cats, that's percentage is 42%. And there are conditions during an extraction, it's very possible to accidentally break the root of the tooth you're trying to remove. When you break a root and you don't have X-rays, it can be very difficult to find it and to know that you removed all parts of it. And the vast majority of the time, if you leave part of a root or a root tip behind, there's a good chance that's going to get infected or that's going to cause pain down the road. So radiographs are really important, especially in cat dentistry. The roots of cat teeth are really narrow and very easy to break. When I'm doing a cat dental, I really just have to get myself in a meditative mindset because you cannot be in a rush. You have to move slow, be patient, give the teeth time or give the roots time to lift out because they're very easy to break. And then I have magnifying loupes or glasses that help me kind of see better to try and find those root tips and get them out of there too. But you need the X-ray in order to be able to do that. And just as another example of things you see on X-ray, this one on the left, you probably could see on the outside of the tooth that the gums were receding and the tops, at least the tops of the roots were visible and exposed. In this X-ray, you can see all three of these teeth have lost more than 50% of the alveolar bone holding them in place. All of those teeth need to be extracted. The image on the right, you're seeing these dark spots around the bottom of the roots on this tooth. We call those periapical lucencies, and these are tooth root infections. And these teeth can often look normal. And so if you didn't have this X-ray, you wouldn't know that this has a bad infection. It's painful. and is compromised and has to be extracted. So the x-rays are important. That adds time, it adds expense to the equipment, additional training to use it. So it's just one of the more advanced things that we have. And then there can be roots left behind, like in the feline oral resorptive lesions. At some point, those crowns break off, the gums will grow over the top, and unless you have x-ray, you don't know if they're there or not. Sometimes the gums grow over and there's no inflammation, and it's debatable whether or not you should go back in and get them. Sometimes it grows over, but there's just a lot of inflammation there, even though there's not a tooth. But often these will be incidental findings during the procedure, and you have to decide if it makes sense to go back in and get those roots, because sometimes these can be potentially painful or predisposed to disease. Extractions. So when we're moving into doing dental extractions, most veterinarians like to do nerve blocks, same sort of thing that happens when we go to the dentist and we're having a filling or something like that. On the human side, you just have to get the nerve block material underneath the gingiva, and it'll diffuse through the bone because our bone is more porous than theirs. In dogs and cats, that doesn't happen. So there's various locations or spots where the roots come out, the infraorbital foramen in these images, and you get your needle into that spot and inject the nerve block there. And that just sort of numbs the root or the pain perception from the root before you start drilling, and that reduces the amount of pain experienced by the patient when they wake up. So simple extractions, usually when we talk simple extractions, we're probably talking about single-rooted teeth, probably more diseased teeth, maybe even loose teeth, or even puppy or kitten teeth. So, but this is basically, I'm just going in there with the elevator along the side. So you wedge this instrument in between the root and the bone, and then you rotate it to create tension. You're trying to get the periodontal ligament to release the tooth so you can get the root out. Periodontal ligament is made to deal with repetitive compressive forces, but that are sudden. It's not made to deal with sustained tension type forces. And so, you're not just going in there and rocking side to side. You're going in there, twisting until you get resistance and holding it for a few seconds to see if you can feel that slowly breaking down. And then you go to another surface of the root and keep doing it. And you have to patiently do that until the tooth is moving enough for you to either just lift it out or to grab something to help lift it out. Okay, we're apparently getting some more graphic images. So complicated or complex extractions, we're usually talking about multi-rooted teeth. And so in this image on the left, you can see these are 3-rooted teeth. And so for this type of a tooth, you have to cut the crown in 2 different planes, 2 different directions, so that you're dealing with one root at a time. If you don't section these teeth, it's really easy, if not almost guaranteed, that you're going to break one or more of the roots, right? Because you're not working with just one cone-shaped root that you're twisting out. You have 3 of those going in there, so you really don't get to do much twisting, and so they're more challenging. So we usually will start with sectioning of the teeth. I know some veterinarians that will actually just cut the crown of the tooth, the top of the tooth off, and then section the teeth just because it makes it easier to focus on where the roots are. But before you're drilling, we'll section the tooth too, but you can see in this image on the right, we also have removed the gums. So we make an incision in the gingiva, we lift the gingiva off of the bone, and then we drill a percentage of the bone overlying each root. And then I like to drill a little gutter along the side so I have some space to put my elevator in. From my experience, you need to remove probably around 30 to 50% of the root on the outside of that root in order to have a reasonably good experience of lifting that root out or wrestling it out. Extracting teeth is like pulling teeth. It's not easy. It takes time and force. Sometimes it is pretty physical. So the more of this bone you remove, the less physical labor you have. And then just to give you some before and after images of the extreme cases I showed you before, that this is how the dog came to us. This is after you remove the tartar, and at least on the upper arcade, it's not hard to imagine those teeth aren't going to come back to health. And then at the end, this is what was left. So the gums here are sutured back together. There's some more suturing that needs to be done here. The dog was able to keep the canine teeth, and those are definitely strategic teeth. I think they're largely the most important teeth in the mouths of dogs and cats, because most of these dogs, even after you take all their teeth out, or cats too, they go back to eating whatever they wanted. They'll go back to eating kibble, and they don't care that they don't have to chew it. When there's painful teeth, they probably aren't chewing it anyway. But if you've ever looked at vomit from either a dog or a cat, normal and healthy, at least 50% of the kibble is unchewed anyway. So they're not going to miss this dog's definitely not going to miss these teeth, and is definitely going to be in a lot less pain once he recovers from the initial trauma of the dental procedure itself, which the mouth heals really quickly, so that doesn't take very long. Okay, and then that really disgusting hair matted plant material one. Unsurprisingly, all of those teeth had to be extracted, but the dog did great. And it's a lot easier to adopt this dog out of a shelter than to adopt this dog out of a shelter. Okay, so just a brief sort of discussion with sort of some information as to why veterinary dentistry costs a lot. And veterinary dentistry requires some special equipment. You need dental extraction kits, other instruments as well. Each set of those you have is a few $100s. The dental machines, so these are the machines that have the high-speed drill, the polisher, and other bells and whistles. And those range widely, but are very expensive. They definitely, like this must have been from some old data, but definitely there are dental machines that exceed $10,000, depending on what you want. I did recently buy a dedicated dentistry table like this. It's nice because you can raise it up and down. It has a little basin to catch the fluid, or because you are running a lot of cold water through the mouth, just like they do with us at the dentist. Heated elements in the tabletop. If you're fancy like that, those tables are super expensive. The X-ray systems are crazy expensive, $10,000, $20,000. And so the practice has to recoup that over time. And so there's an expense there. Definitely there's the expense of staff time. That's, in my experience, often the biggest expense. Dental procedures take time. They're not fast, even just the cleaning, and there's no extractions. There's a lot of time. Putting the patient under anesthesia, scaling the teeth, polishing the teeth, examining the teeth, taking the x-rays. All of that takes time, and you're paying a veterinarian, you're paying a registered veterinary technician, and probably at least one assistant, maybe more. And then just to sort of talk briefly, I did in one of my previous dental presentations, I interviewed a veterinary dentist. The one I spoke with had just recently retired, and this conversation was happening a couple years prior to COVID. And as we know, COVID made everything more expensive, but I think it hit my profession a lot harder, and mainly for staffing issues, workforce issues. But on the human side, we don't think of the dental cleaning as being worth much financially, because either our insurance covers the total cost, or the dentist puts it out as a loss leader to get you in the door to offer or deal with more advanced things. So maybe 0 to 300 on the human side. Simple extractions, a few $100. Complex extractions, maybe up to a couple thousand a piece. Like an impacted molar, she said, would be about $3,500, and gave me an example. But in addition to those costs, you're looking at the cost of different types of anesthesia or sedation, which can get very expensive. And again, even on the human side, dental extractions take a lot of time. So this $200 per 15 minutes, you're going to multiply that several times before a single tooth is out. So I didn't do a slide of the cost or the average cost of veterinary dentistry on each of this breakdown because it varies so widely depending on the type of practice, the approach of the practice, and how they are building the charges. And so you're really almost never comparing apples to apples. So that's a harder conversation to have. But when you compare the same type of procedure on the human side to the animal side, the veterinary industry, while offering a very similar level of care, is far less expensive than the human side. Um, okay, alternatives. There are places offering anesthesia-free dental procedures. On the veterinary side of things, this is controversial. I'm of the opinion that some dentistry is better than no dentistry, and so I think anesthesia-free dentistry may have a place. I know of some veterinarians that offer anesthesia-free dentistry as a way to encourage their clients to learn more, and so they'll do some anesthesia-free dental, so scaling and polishing of the teeth, and they will take photographs when they're doing that to show to the owner to say, look, this is what's going on with your pet's tooth. It has more advanced disease on this tooth. We need to do a dental, and uses it as a way to negotiate and educate. But there are really significant limitations to these procedures. And depending on the patient, depending on the place doing this, you may only be using hand scalers like you see in this image. So instead of the ultrasonic scaler, you're just scraping the calculus off of the tooth with these hand scalers, which is fine. It works. It's safe. You don't pit the teeth as much. And then the polishers, if the animal is tolerant of it, that's a similar kind of thing. But even with the hand scaler, you're unlikely to get up under the gum line, under the gingiva, because it gets uncomfortable and it hurts, and you can't tell the pet what you're doing. And so there's always a limitation to how thorough of a cleaning you can do. If any of the teeth are significantly diseased, then attempting to clean them is painful. Certainly, if they're loose, it's painful. And you're simply never going to get dental x-rays this way. So you're neglecting this deeper disease. I have a friend who, for years did exclusively anesthesia-free dentistry for her pets because she thought it was better. And then she came and we did a dental procedure, and I showed you these teeth looked good, but then you got in there and you took the x-rays, and a lot of the teeth had already lost more than 50% of the alveolar bone. And so we just, I think most pet owners don't know the difference. And most of us are really nervous about anesthesia in our pets. And we hear horror stories out there all the time. There are always risks of anesthesia, but they are very, very low. They're not nearly as common as it would seem if you look out there online. And again, when you have advanced disease, you're balancing a low potential risk of anesthesia with a very strong likelihood of pain and compromise to health. And so I really just try and encourage my clients to understand that the risks are really limited, running blood work before the procedure, to know as much as we can about the health of the pet first is definitely valuable, but the risks are very low. And then there are a lot of products out on the market for dental health. You've got dental treats like greenies. These are usually, their argument is that there's enzymes in them, that when they chew on them, the enzymes will break down some of the tartar or plaque on the teeth, or maybe it's structured in a certain way. When they chew on it, it'll scrape the tooth and kind of brush it. There's enzymatic powders. There's other different kinds of flush or gel that you would apply to the tooth. And then powder again. And then there's diets where they just make the kibble, and it's structured in a way that when the tooth bites it, it sinks into it and the kibble scratches the outside of the tooth. And so there are some studies on some of these products that show some value. In my opinion, these products all exist almost entirely as marketing agents. Oh, I didn't talk about, there's also water additives that are out there too. So like basically turning your pet's water into mouthwash. Um, I don't like this at all. It's going to change the taste and the smell of the water, and especially in cats, anything that might possibly discourage the pet from drinking water is not a great idea. And then, mouthwash kills some bacteria in your mouth when the mouthwash is in your mouth, but it doesn't last very long after that. So, in my opinion, none of those things comes anywhere near to being as effective as brushing your pet's teeth. Ideally, every day, at least several times a week if you can. You need to get to the plaque before it forms into the mineralized calculus on the outside of the tooth. And so they make flavored pet toothpaste, so chicken or beef or maybe fish flavor. And I always encourage my clients to start by offering it as a treat on their finger. So just let the pet lick it off of your finger, get them used to that, lots of positive interaction. And then the next time you try, get them used to you touching around their mouth, maybe touching the teeth. And then the next time you graduate to brushing the outside of the teeth with just your finger. And then you graduate up to some form of brush. I always liked these little things that slipped over your finger because to me, it felt easier than jabbing in a more traditional brush, but there's all sorts of brushes and little nubbin things on the market. The key with making this work is to be patient and to make it a positive experience for the pet. So lots of treats, lots of pets, lots of love afterwards. So, and then just in general, if you're not going to brush your pet's teeth every day, and I don't myself, but it's easier for me to bring them in for the procedures. You got to plan for some frequency of dental procedures. So, the industry nowadays is recommending both daily brushing and a cleaning every 6 months, just like they tell us to do. And it makes just as much sense for the oral health of our pets as it does for us. Um, in my experience, I don't try to push that too hard because most of my clients look at me like I'm crazy when I say that. So I think most pets are okay with a cleaning maybe every 3 to 5 years, but it definitely varies widely. And you're running a risk that some of those teeth might be compromised. It doesn't take a dentist to recognize dental disease, at least certain elements of it from the outside. If you're willing to look at your pet's teeth, and you don't just look at the teeth in the front, you got to look all the way in the back, at least on the top, because that's where most of the disease happens too. Again, I've said it a few times, some dentistry is better than no dentistry. So in my practice, I offer partial dental. So I give my standard dental estimate, but I say, look, if you can't afford this, just let us know where to draw the line and we'll get as much done as we can. And then we can plan for the rest later. But definitely some pets, some breeds, some specific disease process cases like stomatitis are going to need more frequent procedures or more frequent care. And then once again, just my average dental has about 10 extractions. I do procedures where more than 30 teeth need to be extracted in a single procedure. And so these are very involved procedures, but at the same time, understandably improve the health and comfort of the pet. All right, I think I went a little bit long there, but I think I'm open for questions if anybody has any.
So as we said before, if there are any
Oh, hi there. Sorry,
questions, you can put them in oh, now there's one in the Q&A.
yeah, I was
There's,
unmuting there. Sorry for that.
okay.
So first question, is dentistry in dogs covered by insurance?
Everything with pet dental insurance, the devil's in the details. It depends on the policy. You have to look at the fine print. Yes, there are definitely there is dental coverage in some pet insurance policies. Maybe it covers like a routine cleaning every year, every other year, something like that. So some of them have it, but not all.
Great. Okay. And the second question, on average, what age should dental cleanings be started?
Assuming you're not talking about a cat with stomatitis or feline oral resorptive lesions, in my experience, trying to be conservative and realistic in recommendations, maybe around 3 years of age, but ask your vet where things are at, look at the teeth yourself, because there's definitely some patients that need it earlier than that. The classic case is the Chihuahua. Like, even if you're brushing a Chihuahua's teeth every day, or really just the smaller the dog, the more frequent you probably have to do the dental procedures. Not always, but usually. Um, you can brush the teeth, or you can do a dental procedure. I live with a Chihuahua that we did a dental on that dog 2 or 3 times a year, and every time we were extracting teeth. Until now, he doesn't have any more teeth, so he doesn't have to have us do that to him anymore. But you are fighting an uphill battle with some of these dogs. So there's definitely individual variation. Definitely talk to your veterinarian about where your pet's teeth are at, what they recommend as the best way to approach it.
Yeah, I think the part of the caveat, as you said, Dr. Jeff, is certain mouths are sometimes a little more susceptible, and like Boston Terriers and some of the brachycephalics with a turned tooth, then you end up with disease, and then crowding makes a difference too. And some breeds like Yorkies will not get rid of their deciduous teeth, and so you have the baby teeth smushed right against the canines, the permanent teeth, and then you've got this perfect place for bacteria and tartar to have a heyday. So that I think that's the individual patient may dictate a cleaning earlier or later, depending on their oral anatomy as well as their oral health. So here's another question. I was told my dog's teeth have staining. Is brushing best for that?
There's a lot open to interpretation here. Not every veterinarian uses words to mean the same things. When I think of staining, for me, that's a different color on the surface of the tooth that cannot be removed with reasonable scaling. There's a few different things that can cause that. But it doesn't necessarily reflect disease. I believe there's different things that cause different sort of color changes, but I usually actual staining I don't think is as common. Like, I can usually get rid of everything on the outside of the tooth, um, but yeah. So I don't know, how do you handle that one, Dr. Perch?
Yeah, that's a good question. I do think older dogs, especially, you can kind of get that gray green kind of discoloration versus the brown tartar color. It's pretty rare, but dogs do get like enamel hypoplasia where they can have a tendency to have staining without necessarily dental disease. So, they're not usually smoking cigarettes and drinking a lot of coffee. So that kind of red wine. So that kind of staining is not a problem. But they certainly, I think that the anatomy, this is where a dental would be a good idea. So you can look at the anatomy and whether the stains are related to disease versus just a discoloration. Okay, and we have one more question here. In cats, if a front tooth breaks off, will it grow back? And that answer is no. So I can even answer that one.
Yeah.
Yeah. So, and if you're talking about the canines, which are the fang teeth, that is one of the teeth that cats will sometimes break off. And if the cavity in the middle of that is exposed, then that can become an infection and painful.
And because the pulp cavity, and the inside of the tooth where the nerve is in cats, is so narrow and goes so far down the canine tooth, anything more than about a millimeter of the tip of that tooth being broken off is very likely exposing the pulp cavity. So even if you can't see it, that tooth may well be painful. That tooth is at risk of infection. But definitely, if you look at that broken tooth and you can see the dark spot in the middle, that one's bad. You got to get rid of it.
Yeah. And another thing that we can add, and I'm not sure that it's a little bit esoteric for this conversation, but certain dogs, dachshunds would be probably the most common, is the root of their tooth is really going up pretty much into the nasal cavity. And so they can actually, if they have an abscess there, can have what's called an oral nasal fistula. So there's actually a tube into the nose, and you can get nasal disease because of an infection at the base of the tooth.
And then also you can get, it's really kind of common to get a tooth root infection. So you have a dog that has bad teeth, but then it gets a wound underneath its eye that drains and maybe goes away with some antibiotics, but then comes back. That's classically a carnasial root abscess, and that's how we sometimes find out about it. There's a homeless gentleman that lives near my apartment and has a really sweet dog, so I talk to him often and saw that on his dog, and it took me a really long time to convince him what it was, and then a really long time to convince him to let me do the dental on his dog, because the dog's so important to him. But he did. He let me do the dental. All the teeth had to go. But Buster Posey's doing a lot better now.
And hopefully he'll manage a good baseball team this year too. So sorry, that's
Hey, Marianne, I'm noticing that there's also a question in the chat.
oh, okay, great. I will so I've got a couple here with the questions. So we will move back and forth here. So we in the question, the Q&A we have, I have a 3-year-old Pomeranian Chihuahua, and we brush every night. I mostly brush the upper and lower rear teeth. Should I pay more attention to the front teeth?
Ideally, you would brush at least all of the outside surface of the teeth. If you can get on the inside of the tooth, obviously there's relevance in brushing the inside or the palatal side or the inside next to the tongue. But I think that the canine teeth, the fangs, are I think the most important teeth. You want to make sure you're brushing that at least occasionally. But in most dogs and cats, the most advanced disease does happen at those upper molars, premolars at the back of the mouth on the upper arcade. So that's the most important area. But yeah, I would always try and brush at least the outside surface of all the teeth. Give it a shot for the inside, but we get as much done as we can. The more that we can do, the more often we can do, the less likely the patient will need frequent dentistry. It's a very small percentage of my clients that brush their pets' teeth every day, but they all say the same thing. It's part of my routine. We both enjoy it. It's not a problem. And very rarely do I feel those pets need more advanced dentistry. Always a good idea to clean it and take x-rays, but those teeth look and stay really healthy. It's actually, I think, because their teeth are usually a little further apart than ours, brushing goes a lot further for their oral health than it does for us.
Yeah, that's a good question. And actually that is in both the chat and the Q&A, one of the questions is how much time should be spent brushing teeth? Per
There's
brush, like how many minutes?
I don't know. There's an answer for that on the human side, and I'm myself woefully below the time I'm supposed to be spending on my own teeth. Um, I think I don't know. I mean, I would say it probably the thing, you don't want to rush it. You don't want to upset the animal, but as long as you're able to effectively do it, I think, a couple of minutes should be enough. Few minutes should be enough most of the time. Um, I mean, in a cat, if the cat's really tolerating it, there's not a lot of dental real estate, so it may not take very much time at all.
Yeah. And one of the things I'd say is if you're using the little finger brush, don't do the inside of the teeth on your cat. Yeah, there'll be some consequences there. Those are sharp teeth. All right, we have 2 more questions that we're going to answer here. And the first one I actually can help with. It says, my dog just developed a heart murmur. Is this from his teeth? Is there any way to change the bacteria in the mouth to being less prone for dental disease? She has a rescue Chiweenie whose teeth get dirty right away. So the heart murmur one, unlikely that the bacteria has caused the murmur. That's actually a little more common in people, but dogs do get a bacterial. It's called bacterial endocarditis, where the valves have a bacterial plaque on it. if your dog has a murmur, and there's usually a degenerative murmur that dogs will get, then there is a higher risk of bacteria going to that valve. And so there it's unlikely that bacteria is the source, not impossible, but because dogs will get murmurs for other reasons, we don't usually implicate the teeth for that. So great. And then I think this will be our last question. And there was a comment about how inspiring the photo from the shelter was. So thank you for sharing that, Dr. Jeff. And when is an animal dental practice better option than for a primary vet for a pet?
Uh, that really depends on the pet owner or what's going on with the animal, right? So I think in a perfect world, we would always go to the specialists for everything, right? We would always go to the, highest level of care because the risks are going to be lower. You have expertise to deal with, things that might happen that sure might be rare, but you want the right equipment and the right expertise. I don't actually know. I haven't spent time at a veterinary dental practice, but my assumption is the majority of the procedures they're performing are more advanced. Not all. I mean, they certainly do routine procedures as well, but if you want root canal, gingivoplasty, some complicated dental fractures, oral tumors. If you want to save the teeth in your pet, root canal, crowns, all of that stuff is possible. That's not performed at most general practices. There's definitely general practitioners that are interested in that level of care, that get the training and that provide that care. At my practice, I always mention dental veterinary dentists, but will certainly drive my clients in that direction if there's really just advanced disease and the owner really doesn't want to extract the teeth. We never really like the idea of extracting teeth. My clients all the time are shocked when I say we're going to need to do it and they struggle with it. But, if it's diseased, if it's loose, if it's painful, you don't want to leave it behind. I do some care for law enforcement dogs. So working dogs at my practice, these are ones that, if there's a reason for those teeth to stay there and stay healthy. Those teeth, I do just the cleaning and assessment, and then I drive those over to the dentist because I just don't do the more advanced care to save those teeth. The only sort of option I'm comfortable or trained with is to remove them when they're causing trouble.
Yeah. And I would say that's in my experience, the patients that go to the specialist, either potentially there's wanting to salvage a tooth or that's an injury where there's a risk of the jaw breaking and a bunch of other things that would be outside of routine dental care. Yeah. So great. Well, thank you everyone for joining us. There's a lot of positive things in the chat and the Q&A of how informative the presentation was. So we appreciate that. And I believe that a questionnaire goes out to those of you who attended and that we can, will help us design the future conversations or, what the topics for the webinars will be. So please give us your feedback. And reiterating that we are birchbarkfoundation.org and we would love your support for what we do to preserve the human-animal bond.
Thank you, Marianne. I just mentioned the survey in the chat, and I also put the email address there for anyone who would like to follow that through and see what we're all about and consider giving us a donation when the time is right. Thank you, Dr. Jeff, very much for your time. Thank you, everybody, for joining us and staying on. We had a lot of people stay well over time, so thank you so much for that. It speaks to the value of the conversation. So thank you again, Dr. Jeff. Great presentation. Thank you,
Thank you.
Marianne, and thank you everyone for joining and staying with us.
All right. Thank
Thanks.
you. Have a good night, everyone.